And welcome back. Coming up on 9:15, according to the Asthma and Allergy Foundation of America, Louisiana consistently ranks among the top worst states to live for seasonal allergies. Now, allergies have affected over 50 million Americans, and they're the sixth leading cause of chronic illness in the United States. May is Asthma and Allergy Awareness Month, and we have Dr. Brent Wallis from People's Health with us with some insight and tips on keeping allergies at bay. So it seems a lot of people complain about allergies, and you know, Doc, this time of year seems to be the worst time. Why is spring the worst time?
Yeah, definitely. This is when allergies really start kicking up. And what it's related to in the springtime is you have a lot of trees starting to bloom, flowers flowering. So you get a lot of pollen in the air, and that pollen is what people react to. So their allergies tend to really flare up kind of in the spring and summertime.
And especially in Louisiana, being one of the tops for allergens, you know, I guess we just have such lush greenery. We have the perfect environment. We get a lot of rain. We have a lot of warmth. So things really grow, and they grow in masses here, too. So I'm sure that allows a lot of pollen to release in the air.
Yeah, especially with all this rain that we've had recently, you know, we're seeing a lot of things blooming pretty vigorously. So it does get worse. What's nice about the rain is that it does take the pollen out of the air for a brief period of time. So sometimes you get a little respite after a rainstorm.
Absolutely. So let's talk about some of the different allergens this time of year. What do we need to avoid? And, you know, a lot of times you have to get out and about and do things. How do you avoid some of these issues?
Yeah, really, it's difficult because they are everywhere. And so what we tell people is to be on the lookout. Usually, weather reports will tell you how bad the pollen counts are those days. So those may be days you want to spend a little bit less time outdoor. The real treatment for allergies is avoidance. So another thing that we've seen actually in this past year is the wearing of masks, especially when you're outdoors, has actually really decreased the incidence of allergies and the problems that people have been having. Another thing I tell people to do too, if you do have to be outdoors, when you do come back home, sometimes it's good to take a shower before you go to bed because you're washing all of those allergens off of you.
So let's talk about ages. Are some people born with allergies, or does it develop over time? I mean, how does it work in terms of with the exposure that we have here? Does it eventually build up to a point where you may not have it in earlier years, but you actually develop it later?
Yeah, you definitely can. We tend to see allergies much more commonly in children. And sometimes they present with sinus type symptoms, but sometimes it can actually be rashes as well. But what a lot of people don't realize is as you get older, because of that constant exposure to pollens and other allergens, you can actually develop new allergies much later in life. And a lot of people don't realize that that can happen. So when they start developing those symptoms, they think something's wrong. That's why it's real important to talk to your doctor if you do start developing a whole lot of sneezing, watery eyes, or runny nose. Another thing to kind of keep in mind is that allergies run in families. So if you have one parent with sinus allergies, then usually you're about 40% more likely to have them. But if you have two parents with allergies, you're over 50% more likely to have allergies yourself.
It's amazing how genetics play a role in so many different health things. So very quickly, we have about 30 seconds left. If you do develop allergies and you're battling it, what are some of the fixes? Medications, shots, things like that?
Yeah, we have a whole lot of treatments available. You should definitely talk to your doctor before you start something, especially if you have other medical conditions like high blood pressure. Some of the medicines can have interactions with other things you're taking or with diseases. But like I said, there are a lot of over-the-counter treatments. If it's really severe, your doctor may even send you to an allergist to figure out what you're reacting to so that you can really try to avoid that in the future.
Absolutely. Dr. Brent Wallis, thank you very much. And again, we love to get out and about this time of year, but you have to protect yourself as well. Thanks for the time.
Thank you.
You betcha.